welcome to Focus Today. I'm your host, Perry Atkinson, and what a delight and an honor for us to have with us today Dr. Larry Altshuler. He's a board-certified internist at the Cancer Treatment Centers of America, better known as CTCA, at the Southwestern Regional Medical Center, author of Balance, Healing, and Dr. Say What? And we're here to talk to him today about a lot of things. So also better known as Dr. A. So is that okay, Dr. A?
That would be perfect.
Thanks for being with us today. You know, we've talked a lot on this program about cancer and how epidemic it really is in so many ways. But the president's got a effort now calling the Moonshot effort to cure cancer in 10 years. As a person and a professional in that field, is this realistic?
In actuality, it's not very realistic, unfortunately. In fact, there are some experts in cancer that don't think cancer will ever be cured, and there's quite a few reasons for that. Number one is cancer is not just one disease. There are hundreds of types of cancers, and then there are hundreds of subtypes of cancers, and they're all different. They all act differently, and in each person they can act differently. So say you have two people with the same type of cancer, the same stage of cancer, and you treat them the same, one may get benefit, one may not get benefit. So it's such a wide range of subtypes that a cure, quote unquote, is fairly unrealistic. And we also have to realize that we've had actually a moonshot on cancer that was started by President Nixon 41 years ago. Now that has helped. We have progressed in our research and we've found great discoveries, but we're still a long way away from achieving, a cure, if ever.
Has it increased over the years, Doctor? I mean, it appears to me, and I don't know why we're not calling it epidemic, but it appears to be at epidemic levels. Am I wrong?
You are not wrong. The incidence of cancer has steadily increased. It will continue to increase because of the aging of the population. What's ironic is that heart disease, which used to be the #1 killer, it still is, but it's decreasing quite constantly. But now that we are controlling diseases such as heart disease, diabetes, and other diseases like that, those are better controlled. It makes us live longer, and therefore we have a more chance to develop cancer, which occurs as we get older. It doesn't mean that middle-aged people don't get cancer, because that's going up also. But yes, the incidence of cancer is definitely going up. The good part of that is that the death rate is going down while the incidence is going up. So obviously we are making progress.
Okay. Tell us about the cancer treatment centers and how you treat patients that make it so unique and different.
Well, it's really our model of care. We have an integrative model of care, so we not only use conventional medicine, but we also use alternative medicine. Now, I need to kind of explain that because there are people out there that only want to use alternative medicine, but alternative medicine does not cure cancer. Only conventional medicine cures cancer. So what we do is we use conventional medicine to attack the cancer, to fight the cancer, and our policy is to get the best technology that we possibly can, allow people to have all the options that are available, and then we use integrative medicine to complement that, if we can, to enhance the conventional treatments, but especially to address quality of life, which is really, really important in cancer treatment. When people get treated with cancer, they have side effects. They have side effects from the cancer. They have complications, and those are called the quality of life issues. There's people who say, I don't want chemotherapy because the treatment is worse than the disease. We don't like that. So we address all those quality of life issues so that people can not only fight their cancer, but feel good at the same time and have a life, work, be with their friends, their family, do what they want to do. So it's a real unique model of care. that is very, very successful. We have a very, very high satisfaction rating, and that's the way we want it. We want people to have hope and be able to come here and get the best of both worlds.
So is that kind of the summary of what you would call individualized treatments?
It's really personalized medicine. You know, the precision medicine that Obama talks about is a little bit more scientific. Personalized medicine basically, you know, looks at the patient as a whole person, body, mind, and spirit. It takes into account not only the disease, but you know, their lifestyle, their environment, their socioeconomic factors, so that we really focus on the patient. Precision medicine kind of overlaps personalized medicine, but it's really based on genetics. You know, finding out what the genes are. And in cancer, that means looking at the tumors and finding out what mutations are occurring in these tumors that are making them grow. So what we're finding out with precision medicine is we're trying to target those mutations. We find a mutation, we find a drug or a chemotherapy that can actually target that mutation and stop that mutation in its tracks. And that's where precision medicine really comes in. So it's kind of both of those.
Excellent. That's very hopeful. Has the current healthcare system in America, and you know how complicated and confused and messed up as it is that interfering with good cancer treatment?
Unfortunately, I think it is. And in fact, that's actually one of the reasons I wrote my book, Doctors Say What, because I wanted people to know that even with this dysfunction we have, that you can actually work around the dysfunction and get the best health care, get the care that you need. Unfortunately, our system is dysfunctional. And in cancer care, we see a lot that is really not desirable as far as I'm concerned. I am the director of oncology intake here at CTCA, which means I'm the first doctor that most patients will see when they come here. So I hear all their stories. I take their history, so I know what's going on. If they've been treated elsewhere, I find out, you know, everything that they've done. And what we are finding, and in fact, this was actually reported at a meeting at the American Society of Oncology, clinical oncology. It's called ASCO, and they have a big meeting every year. And there were some reports back in 2011 that showed that an incredible number of patients with cancer were suffering needlessly from quality of life issues. In late stages, almost 70 to 90% were suffering. In early stages, 50 to 70%. And then they also said that of all the oncologists, that less than 1/3 of oncologists, who are the cancer specialists, are trained to address quality of life. So what you're seeing is that, you know, you go to a cancer doctor, they're going to concentrate on treating the cancer, but they may not be trained, or they may not address all the other issues, the side effects, the complications. What we are also finding is that even with the quality of life issues, even if the oncologists address it, they use conventional treatments. Now, there are a lot of great conventional treatments for that, but there are some side effects that conventional treatments are just not very good at. They don't really help people. So that's why we use a lot of the alternative methods for quality of life. And we are finding that they work very, very well in most people for most side effects of cancer. But unfortunately, overall, patients may not get that type of treatment. So that's why I wanted to talk to people and write my book. I have about a 40-page section on cancer, so they'll know exactly what to look for, what to ask their oncologist for. And if the oncologist can't give it to them, then they can go out and find an acupuncturist or a naturopath and get the care they need.
I'll talk to you about your book when we come back from the break, but before we take a break, in the whole process there at CTCA, how do you allow for or integrate faith into the equation?
Well, faith is extremely important. Actually, we have an entire section of pastoral care section. It's very, very strong. Most of the people who come here, they go ahead and get a pastoral consult. And, you know, if they don't want one, that's okay. But most people do. We think it's very important. The spiritual aspect of treatment, especially for a disease like cancer, extremely important. So we have not just one or two, we have several pastors here who work with the patients, whether they're in the outpatient or in the hospital. And I have found that to be extremely important, and those people do so well.
All right, let me take a break here. Doctor, we'll come back. We'll talk about your book, Doctor, Say What? And let me say to our viewers and listeners, you can go to cancercenter.com is the website, cancercenter.com. We'll be right back.
I'm Paulina Leiser, producer of Focus Today. Thank you for watching this video, and make sure to check our other videos at theDove.us.
Okay, welcome back, and what a delight and an honor to have with us today Dr. Larry Altshuler. He is a board-certified internist at the Cancer Treatment Centers of America. You perhaps have seen some of their ads on television. These folks do it right. CTA, and you can go to cancercenters.com, and the doctor just told me, here's the 800 number, or a toll-free number that you may want to check out, 888-242-6536. And when you call that 24 hours a day, you'll get a real person that's been highly trained to talk to you and to guide you where you should go for your treatment, and especially the connection there with the CTCA. Okay, doctor, let's talk about your book. You say it comes in two parts. The second one is already, or the first one's already out, the second one due to be released. Why'd you go down this road? What were you trying to do here?
Well, you know, we had talked about the dysfunction in the healthcare system. You know, in the United States, we pay more per person for healthcare than any other country in the world. But then when you look at the quality indicators, they're at the bottom compared to other industrialized nations. So, you know, you look at that and you say, okay, where's this disconnect? Why are we paying so much money but not getting what we pay for? And of course, that's due to the dysfunction. So what I wanted to do was basically tell people, okay, I'm going to point out where the areas are of dysfunction, and how you can get around that dysfunction. You know, give you information so you can become empowered and take an active role and find out what are the best things that you need to know so you can get the best health care and make sure that you get the best health care. And so that's actually why I wrote the books.
All right, now the second book, by the way, folks, this book is available on Amazon, and it's called Doctor, Say What? By Dr. Larry Altshuler, so look for it there.
Right.
And the second book will be there in about a week or so, and that's the one that has the cancer section in it?
Right. The first book is basically has a subtitle of The Inside Scoop on Getting the Best Health Care. So it goes over preventive care, conventional care, alternative, but it also talks about insurance, talks about research, the media, everything you want to know about medicine. The second book is a subtitle, The Guides, and that's exactly what it is. It tells you what works, what doesn't. It's an integrative approach with over 90 medical conditions, so it's step by step. It tells you what works, what doesn't work, what to stay away from, what's the least cost, what's going to work the best, what's going to work the longest, and that's for over 90 medical conditions. So it's a great guide. I mean, I love doing it, and I've loved helping people all these years, and that's what the book is for.
Well, thank you for your work and your contribution there. It's got to be a tremendous resource. I want to come back to alternative medicine. You certainly make it a part of what you do there at CTCA, and I really commend you for this. A lot of people are turning to alternative medicine for a lot of alternative reasons, but it also has set up a conflict as to whether or not the FDA is going to recognize some of it, whether or not insurance companies are going to recognize some of it, but you obviously see the benefits of it. How big is this divide?
Unfortunately, it is a big divide, and I'll tell you, I was very unhappy. Last week, I went to a continuing medical education course for primary care physicians, and there were some lectures on cancer and actually some lectures on heart disease as well. And neither of the lecturers, who come from really fine institutions, used alternative medicine, and they didn't even talk about alternative medicine. And I pointed out to both of them that alternative medicine has been shown in studies. We have the evidence that they can really benefit people with heart disease and cancer. And they really had no knowledge of it. They really didn't use it. And so here they are teaching other doctors, and they're not even talking about it. So there's a pretty big divide. Now, part of that, of course, is insurance and Medicare. A lot of them do not cover most alternative therapies. I think that's a real shame. You know, with the Affordable Care Act, they're looking to decrease cost and improve quality. Well, what I have found is that alternative methods is one way to do that because they are low cost and they can do quite a bit. They can increase the quality and really help people. So if we really want to get cost-effective medicine, we need to do that. But up to this point, insurance companies and Medicare have really not done much to incorporate that because they really follow the lead of conventional doctors. I'm hoping, however, in the future that they will realize that this is really cost-effective. It may not work in everyone, and of course, I say that in my book. I tell people sometimes start with conventional medicine, you know, or in this case, you can start with alternative medicine. But if we really integrate it and integrate the evidence-based alternative methods that have been proven effective, I think you're going to see our quality of health improve immensely. So I'm hoping to convince insurance companies and Medicare to do that. We here are doing a bunch of research on our alternative methods for our patients because I think the more research we do and the more evidence we give, the more likely they'll be to go ahead and reimburse for that.
Good for you, and I commend you in doing it. Let me go off the grid a little bit. Just a couple of quick questions, talking to you as a physician. Where are you with supplements?
Well, we actually, you mean here or just me in general?
Well, either one.
Okay, well, because I have to say, you know, this book is actually, my book is not actually associated with CTCA, but they have supported me in it. But they're mainly my opinions, of course. And I have a lot of sections on nutritional supplements. Here at CTCA, we actually have certified naturopaths who are subspecialized in treating cancer patients. What we're finding is that there are certain nutritional supplements that really can boost the immune system, they can enhance conventional treatments, and they can address side effects and complications. Now, the problem is, you know, people go to the internet and they read about all these wonderful herbs and supplements, and they say, oh, I need this one and I need this one. And we see people taking, you know, 50 or 60 supplements. And in actuality, a lot of those are not going to help, and they may even interfere with the good conventional treatments. So that's why we have naturopaths here, because we want people to know, okay, this is going to be useful for you. This is going to interfere. This you might as well not take. It's not going to have any use for you. And try to trim it down so people don't have to take so many nutritional supplements. But many of them are valuable. One example is curcumin. It's been shown to interfere in the cancer pathway at 10 different places in the cancer pathway. Fish oil has been shown to be beneficial, especially in people who don't have much of an appetite and are losing weight. So there are quite a few that are very beneficial for cancer patients, as well as, of course, other chronic medical conditions.
Another topic that keeps popping up, and I'm hearing more and more about it, so I just forgive me for my ignorance, but is it true that the American medical community does not recognize Crohn's disease?
I'm not aware of that. You know, of course, I'm an internist. I've treated Crohn's disease before, but I think most gastroenterologists, most doctors really think Crohn's disease is an actual disease. we call it inflammatory bowel disease. Crohn's disease, ulcerative colitis kind of go hand in hand, but I actually haven't heard that. For what I know, we still look at Crohn's disease and we treat it as a disease.
Yeah, I'm sorry, I made a mistake there. I apologize. I meant to say Lyme disease.
Oh, Lyme disease?
Yes.
You know, I will tell you that when any new disease comes out, there's always detractors, and there's always people who say, oh, it's not a disease. Lyme disease was one of those, but now it's been proven it's definitely a disease. Fibromyalgia is another one. I mean, for years, fibromyalgia was not thought to be a real disease. It was all in your head. Now they have documented that it is a real disease. You know, it just takes the medical community sometimes several years to change their thought process and adapt to new discoveries.
Well, Doctor, I want to say thank you for your work, and especially you and your team there at the Cancer Treatment Centers of America. I hear nothing but good reports. You have found the most appropriate balance between conventional and alternative. You certainly allow for spiritual and faith input. The combination of that and the reviews coming from your centers have been extremely encouraging.
Well, I really appreciate that. I've worked here for 7 years now, and I will tell you, for someone like me, a doctor, it's the best place in the world to work. The patients are great. It's just a very beautiful environment, a hopeful environment, a spiritual environment. People come here and they're really just blown away by the acceptance. Everyone's smiling, and really that's the way it should be in medical care. And that same integrative approach is what I use in my books, because we want to help people. And I think most doctors want to help people. And I hope in the future, everyone will have this kind of integrative model.
Well, let me say to our viewers and listeners, the book series is Doctors Say What, and it's available on Amazon. The first edition is there, and then the guide, second edition, will be there in about a week. Again, it's called Doctors Say What by Dr. Larry Altshuler. And you can also call the Cancer Center. They're the Cancer Treatment Centers of America. Their toll-free line is 1-888-242-6536, and you'll get a real person on the phone, not a machine, but a real person that's been trained to take your call. And if you need to check it all out, you can go to cancercenters.com, cancercenter.com. Dr. Larry, thank you, my friend. You're an inspiration, and let's connect soon on the other side. I want to get a copy of your book, and then we'll get you back and we'll talk about it.
Actually, I have one right here, if you can see it.
Yeah.
I don't know how well you can see that.
That's good. Yeah, we can see that fine.
Camera, that's a copy of it, and we will send you a copy as soon as both of them come out.
All right, then we'll get you back on. Thanks for being with us today.
Well, thank you for inviting me. I hope we've helped a lot of people out there.
All right, God bless you. All right, we'll see you next time.